All right, so we're diving deep today
Yeah.
into how your body recovers after heart surgery,
Right.
specifically coronary artery bypass grafting.
Mm-hmm.
We're going to be looking at a protein called fibronectin,
Okay.
and it could be a biological compass to figure out how well somebody's healing.
Interesting.
And I'm really excited to talk about this
Me too.
because this is
Yeah,
kind of cutting-edge stuff.
it is.
So
Yeah.
we're taking our info today
Okay.
from a research paper that came straight from Wrocław Medical University,
All right.
and it was published in Nature Scientific Reports.
Nice.
And the authors
Yeah.
were Dr. Anna Lemańska-Perek,
Okay.
Dr. Dorota Krzyżanowska-Gobe,
Mm-hmm.
and Professor Barbara Adamick.
I see.
And they're really digging into fibronectin's role in the recovery process.
Yeah.
It's complicated.
It's a complicated process.
Mhm.
So are you ready to uncover some of the secrets
Oh, yeah.
of this protein and how it may impact?
Personalized medicine.
Yeah, let's get into it.
Okay, so you've probably heard
Yeah.
of coronary artery bypass grafting.
Uh-huh.
And just so everybody's on the same page,
Sure.
it's where surgeons use a healthy blood vessel
Okay.
to basically bypass a blocked artery in the heart.
Yeah.
But what's going on at the molecular level
Yeah.
during recovery?
Yeah, that's the question.
That's where fibronectin comes in.
Yeah, and it's important to note that there's not just like one fibronectin.
Right.
You have plasma FN,
Right.
which is circulating in your blood,
Ah.
kind of like first responders ready to
Right.
stop the bleeding.
Yeah.
And then you have cellular FN,
Okay.
which is produced right there at the injury site to kickstart that tissue repair.
So two different types of
Yeah.
fibronectin
Yeah.
with two kind of distinct roles.
Absolutely. And the cellular FN is especially interesting.
Okay, why is that?
Well, because it's like that first responder.
Like they're on the scene.
Yeah, and it plays such a vital role
Okay.
in how that tissue is going to heal.
Okay, so in this study, what did the researchers find out?
Yeah, so they took 40 patients who were undergoing coronary bypass,
Okay.
and they tracked both the plasma FN and the cellular FN levels
Okay.
before, during, and after the surgery.
Oh, wow.
And what they found is
Incredible.
actually really interesting.
What did they find?
It's like a seesaw effect.
The seesaw.
Yeah.
How's that work?
So picture this as the surgery begins.
Okay.
Plasma FN levels plummet.
Okay.
It's like the body's using up all those bandages to quickly patch things up.
Okay.
Meanwhile,
Yeah.
cellular FN
Uh-huh.
gradually rises over the first 24 hours
Okay.
after the surgery.
So one goes up and one goes down.
Yeah, and that indicates that the body's shifting gears towards rebuilding.
Interesting.
Right.
Okay, but why is this so important for someone recovering from heart surgery?
Well, because if the cellular FN stays high after the surgery,
Okay.
that could be a red flag.
Okay.
While it's important for healing,
Uh-huh.
too much of it
Yeah.
can lead to fibrosis.
Fibrosis is a hardening of the heart tissue, right?
That's right.
Yeah. Okay.
And that can increase the risk of complications like heart failure later on.
Oh, wow. So it's like
'Cause
we have an
you-
early warning system,
Yeah.
potentially.
It's about being proactive instead of reactive.
Right.
So by tracking these levels, doctors could potentially predict
Mm-hmm.
who's at a higher risk of
Okay.
developing fibrosis
And then adjust treatment.
and adjust treatment accordingly.
Wow. That's incredible.
It is pretty amazing.
So this can really help personalize medicine.
Absolutely.
But does everybody have the same
Oh, no.
cellular FN levels
Not at all.
of surgery?
The study also found that if you have pre-existing conditions
Okay.
like atherosclerosis,
Mhm.
diabetes, or obesity,
Yeah.
those can all impact cellular FN levels.
So like if you already have higher levels before surgery, you might be more susceptible to developing fibrosis.
Exactly. And that's why it's so important for doctors to know this beforehand so they can provide more personalized care.
That makes sense.
Right.
So it could influence medications,
Absolutely.
the intensity of monitoring,
Uh-huh.
or even surgical decisions to minimize the risk.
Okay. Wow. This is like a personalized roadmap for recovery.
Yeah, it's pretty incredible.
But there's another factor
There is
that came to light in
yeah.
this study,
Yes.
and that is the duration of extracorporeal circulation.
Yeah, that's a mouthful.
Yeah, the heart-lung bypass machine
Right.
that's used during surgery.
Exactly.
So what did they find out about that?
Well, the longer you're on that machine, the more inflammation
Okay.
it triggers in your body.
So longer bypass time,
Uh-huh.
more inflammation.
Right.
And we know that inflammation drives up those cellular FN levels.
Exactly. It's like a domino effect.
Wow. So longer bypass time,
Yeah.
more inflammation,
Mhm.
higher cellular FN.
Greater risk of fibrosis.
You got it.
Wow.
So minimizing that bypass time is absolutely critical.
So this is really insightful.
It is.
Because it really shows how much is going on beneath the surface during recovery.
Right.
And how monitoring something like cellular FN could be a game changer.
It really could. But this research might have implications.
Okay.
Far beyond heart surgery. Are you ready to explore where else this might lead us?
Oh, absolutely.
Okay.
Go.
All right. So elevated cellular FN has also been linked to sepsis severity.
Really? So this protein is involved in
that seems that way.
In how our body deals with infections too.
Yeah. There was even a study on folks with COVID-19 induced sepsis.
Okay.
And guess what?
What?
High cellular FN levels were associated with a greater risk of death.
Oh, wow. So we're talking about a protein that's not just crucial for post-surgery recovery, but potentially for understanding and treating serious infections as well.
Yeah, this is way bigger.
This is way bigger than
we initially thought.
Yeah, we initially thought.
And in that sepsis study, they actually used AI to pinpoint the most important indicators of patient survival.
Oh, wow.
Plasma FN was one of the top predictors.
Wow. So we're seeing how modern technology like AI can leverage these biological insights and potentially save lives.
It's really incredible.
It really is. Okay, so let's bring this back to the listener.
Okay.
What does this research mean for their recovery from heart surgery?
Right.
Or even just for their overall health?
Well, first of all, I think it really underscores that healing is a complex process.
Right.
Your body goes through a lot after surgery, and understanding those intricacies can be really empowering. If you're prepping for heart surgery, don't be afraid to ask your doctor about fibronectin and how they monitor recovery.
So knowledge is power. And asking those questions is key.
Yes. Advocate for yourself.
Absolutely.
And if you have a history of atherosclerosis, diabetes, or obesity, make sure to discuss those conditions with your surgeon.
Yeah.
Because as we discussed, those factors can affect those cellular FN levels.
And that could influence how your recovery goes.
Exactly.
That makes sense. So the more your doctor knows, the better they can tailor your treatment plan.
Exactly.
Okay, but what about after the surgery?
Okay.
What should we be looking out for?
Well, pay attention to how you're feeling.
Okay.
If you notice anything unusual, or if your recovery seems slower than expected, don't hesitate to bring it up with your medical team.
So stay vigilant.
Yes.
And keep those lines of communication open.
Absolutely. That's good advice for any kind of surgery or medical procedure, really.
Yeah. And here's something else to think about. Even if you're not facing heart surgery, this research emphasizes the importance of a healthy lifestyle.
Absolutely.
Managing conditions like atherosclerosis, diabetes, and obesity can positively impact your overall health and potentially reduce your risk of complications down the line.
Absolutely. Prevention is key.
You mentioned earlier that this fibronectin research could have implications beyond heart surgery.
It could.
So let's talk more about that sepsis connection.
Yeah, so those initial findings are really compelling.
Okay.
The fact that cellular FN levels seem to correlate with the severity of sepsis suggests that it could be a valuable biomarker for identifying patients who need more aggressive treatment early on.
So potentially another biological compass, but for a completely different condition.
And think about the potential for personalized treatment here.
Right.
If we can identify which patients are most likely to develop severe sepsis based on their cellular FN levels, we can intervene earlier and potentially improve their chances of survival.
Improve their chances of survival. It's like we're starting to see a pattern here. A protein that was once primarily associated with wound healing might actually hold the key to understanding and treating a wide range of inflammatory conditions.
It's a paradigm shift in how we think about this molecule.
It really is, and it raises an important question.
What's that?
What other conditions might be influenced by fibronectin activity?
Right. We've talked about heart surgery and sepsis.
Right.
But could there be other areas where monitoring this protein could lead to earlier diagnoses, better treatments, other outcomes for patients?
It's a question researchers are actively exploring.
It is.
The more we learn about fibronectin,
the
more we realize how interconnected it is to our health.
It's a reminder that our bodies are incredibly complex, and understanding those complexities can lead to truly groundbreaking discoveries.
Well said. And while we don't have all the answers yet,
Right.
clear that fibronectin research has the potential to change the face of medicine as we know it.
I think so too.
This is really exciting stuff.
It is.
So we've covered a lot of ground today.
We have.
In this deep dive about fibronectin. So let's recap what we've learned and why it's making waves in the medical world.
All right.
We started off by explaining that fibronectin is kind of like this scaffold.
Yeah, it's crucial.
That's crucial.
For wounds to heal, for tissues to regenerate.
And we have these two main types.
Right.
Plasma FN, circulating in your blood.
Right.
And then cellular FN.
Which is produced right at the injury site.
And the research from Dr. Lemańska-Perek, Dr. Sanowska-Gub, and Professor Adamic really zeroed in on how those two forms of fibronectin change after heart surgery.
Right. Specifically after coronary artery bypass grafting.
Exactly. The big takeaway was that plasma FN levels drop.
After surgery.
After surgery.
Yeah, to help with clotting.
Right, to help with clotting.
Yeah.
But then cellular FN levels rise.
Right.
To kickstart those repair processes.
Exactly. But too much cellular FN can be a problem.
Right, because it can lead to fibrosis, which is...
that hardening of the heart tissue.
Right, and that can increase your risk of heart failure.
Exactly.
So this is where monitoring cellular FN becomes really important.
Absolutely.
It could help doctors predict which patients are most likely to have complications and then intervene early.
Yeah, and it could really change how we approach post-surgery care.
Yeah.
And pave the way for more personalized treatment plans.
And we can't forget that this research goes beyond heart surgery.
Oh, absolutely.
Elevated cellular FN has also been linked to sepsis.
Yeah.
Even in cases like COVID-19.
Right.
So this one protein could hold the key to understanding and treating a whole range of conditions.
And don't forget about AI.
Oh, right. AI.
Remember in that sepsis study, plasma FN was a top predictor?
Of patient survival.
Yeah. Powerful stuff.
It is powerful stuff.
Technology and biology coming together to save lives.
That's really amazing.
It is.
So before we wrap up,
I
want to leave you with something to think about.
Okay.
We've seen how monitoring cellular FN could revolutionize care after heart surgery.
Absolutely.
And maybe even improve outcomes for those with sepsis.
Right.
But what if we could take this even further?
Okay.
What if down the line, fibronectin monitoring became standard for all types of surgeries?
Interesting.
Or even for chronic inflammatory conditions?
Yeah.